name's Chelsea and I'm going to be your nurse today. I'm going to perform a physical assessment on you. I would shut the door for privacy and wash my hands. Can you tell me your name and date of birth?
CS 102996.
All right. I'm going to start by getting your vitals. I'd place a pulse oximeter on your left index finger. That would check your O2 saturation as well as your pulse. Go ahead, relax. (102/168) is your blood pressure. 100 is your O2 saturation, and 60 is your pulse. Get your temperature under your tongue. 98.1 is your temperature. And do you have any pain right now on a scale of 0 to 10?
No.
Pain's a 0?
Yes.
Okay. I'm going to start by inspecting your head, and your scalp, looking at your skin and your nails. Okay. Feeling her head for any bumps, lumps, looking at her scalp for any lesions or anything, and looking to make sure her hair is nice and evenly growing in and no bald spots. Looking at her skin, don't notice any abnormal moles or bruises. If she was in a gown, I would look at her legs and her belly as well as her back. Looking at her nails, making sure that they are not thick, brittle. Also checking capillary refill while looking at her nails, and it's less than 3 seconds. Looking at her toes as well for the same thing, abnormalities. And, I do notice that she does have
webbed toes.
Webbed toes. Were you born that way?
I was.
What's that? Very interesting. Next, I'm looking at her face, looking at her head and her neck, palpating her neck, looking to make sure that there's nothing abnormal with that. I'm feeling her temporal arteries. And her carotid artery. And I feel those on both sides. And then I would have you swallow so I can feel your thyroid. Perfect. Now I'm going to listen to your temporal arteries and your carotid arteries. Next, I'm looking at her external ears, noting any abnormality. She does have a piercing on the left ear. The tops of her ears are nice and in line with the outer canthus of her eyes. If I had an otoscope, I would be looking on the inside of her ears to look at the tympanic membrane, making sure that it's nice and gray. Looking at if there's any wax buildup or anything. Any pain in your ears. Feeling her sinuses. Any pain?
No.
Can you open your mouth? Feeling for TMJ. Good. Feels normal. I don't feel any clicking or anything. Now I'm looking at her eyes. I'm looking to make sure that they're nice symmetrical on her face. Not too far spread apart, not too far in. And I'm going to take this pen light and I'm going to have you follow it. Okay. Don't move your head, just your eyes. And down. And then follow it in. Good. And I see that her pupils do accommodate when the object is moved closer. I'm going to check your pupil reactions with the light. And they are equal and reactive. Good. And then tell me when you can see the object coming in on the side.
No. No.
Good. And then I would look at there'd be a chart on the wall. It's called the Snellen chart. It'd have a big E on it. You would stand 20 feet behind it, and you would look at it and read the print, the smallest print that you could.
I do wear contacts.
You wear contacts? Okay.
Yes.
And glasses?
Yes, when I need to.
All right, good to know. So I would make note of that when doing the eye exam, that you have contacts in. Next, I'm looking at your nose and looking at the inside of your nose and your nostrils. Can you go ahead and close one nostril and take a deep breath? Any difficulty?
No.
And the other side? Good. And then I'm just going to put something in front of you and have you smell it, and you tell me what you smell.
Coffee.
All right. Next, I'm looking inside your mouth, making sure that the mucosa is nice and pink and moist. Good. And move your tongue up and down, and side to side. Well, on your face, I'm going to have you clench your eyes tight, and then can you clench your teeth, and then smile, and frown, and raise your eyebrows. Perfect. Okay, good. Next, I'm going to listen to your heart, and I'm going to listen to you while you sit up, then I'm going to have you lay back and lay on your left side.
Okay.
I'm going to listen with the bell of my stethoscope as well as the diaphragm. And you can just breathe normally while you listen to your heart sounds. And I'm going to listen with the bell. I don't hear any murmur or anything. It's nice and strong. Regular heartbeat. Like I said, the pulse earlier was 60. It still sounds to be 60. And go ahead and lay back. Again, I'm going to listen with the bell of my stethoscope. Okay, and then lay on your left side so I can listen to the point of maximum impulse. Good. Alright, on your back, I'm going to feel your pulses. I already felt your carotid pulses, so I'm going to feel your brachial pulses on both sides. Nice and equal, strong, bilaterally. Feel your radial pulses. If you were in the gown, I would feel the back of your knees for your popliteal pulses, your tibial pulses, and your pedal pulses. And everything feels nice and strong, equal bilaterally. Next, I'm going to listen to your lung sounds. When I'm listening to your lung sounds, you can lay on you're going to take a nice deep breath, and then I'm also going to have you say the word 99. When you sit forward and I listen to your back, I'm going to do the same thing, and then I'm also going to feel for firmness as well. Okay. Go ahead and take a deep breath. Okay, and then say the word 99.
99, 99, 99, 99, 99, 99.
Good. Go ahead and sit forward. And deep breath. Say the word 99.
99, 99, 99, 99, 99, 99.
Good. And then I'm going to check for chest symmetry, chest expansion. And it rises both symmetrical on each side, same on the back. And say the word 99.
99, 99, 99, 99.
Perfect. All right, now I'm going to listen. And then I'm going to listen to your belly. First, I'm going to inspect your belly. And then I'm going to listen and palpate and percuss.
Lay down.
Yep, go ahead and lay back. If she was in a gown, I'd pull up her gown and I'd look at her belly first before listening. I would be noticing any hernias or any bruising or anything abnormal. I'd start listening in the right lower quadrant, listening for vowel sounds. Move to the right upper quadrant. While I'm listening to vowel sounds, I'm also listening for the renal artery and the aorta, which is audible. Moving to the left upper quadrant and the left lower quadrant. Then I would palpate. I would do light palpation first. Any pain?
No.
Pain?
No.
Pain?
No.
Any pain?
No.
And then I would do deep palpation. With deep palpation, I'd press a little deeper, and I'd put my hand on your back, and I'd feel for your kidneys when pressing nice and deep, and I would do that on both sides. I would also do percussion over your spleen and your liver. Anything?
No.
All right, and I didn't hear anything abnormal with that assessment. Next, I'm going to look at your joints. So if you want to sit forward, I'm looking at her head and her neck joints, her elbow joints, her wrist joints, her knee joints, and her ankle joints, as well as her fingers and her toes. Can you tilt your head side to side? So I'm looking at the range of motion in her neck, back and forth. Good. And then I would check the strength in her head. Push, and forward, and back. And then I would check the strength in her shoulders. Go ahead and shrug your shoulders. Again. Perfect. And then I would check the range of motion in her shoulders. So put your arms up to the side and back. And then cross them in front of you. Perfect. And then I would check the range of motion in her elbows. So bend them forward and back. And I would also have you put your hands out nice and straight and then flip them over. Good. And then with your hands, pull your thumbs in towards you and push them out to the side. Perfect. And then flex them and extend them. Beautiful. And then I would check the strength in those as well. So go ahead and push your arms up and push your arms down. Push your hands down. Pull your hands towards you and squeeze. Perfect. Can you kick your leg out, your knee, and the other one? As well as looking at her feet and having her extend them and pull forward. And then go ahead and pull forward towards you and push out and push up and push down. Good. And then I'll have you stand up. And I'm going to have you walk towards me so I can look at your gait. Make sure it's nice and steady. You can bear weight on both sides equally. Perfect. Go ahead and walk back. Can you now walk heel to toe? And then when you walk back, can you walk on your toes? And then walk on your heels. And then you can walk back normally. Put your feet together. Run one heel down the front of one shin. And then do it on the other side. And then I would like to test your hip flexion. So put your leg out in front of you. To the side. And back. And then the other side. And back. And then put your feet together and close your eyes. And I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Can you bend forward for me? I'm looking at your spine and I'm checking your hips range of motion. Your spine is nice and straight. Go ahead and stand up for me and you can sit down. Now I'm going to just test your reflexes. Good, it's not hyper-reflexive in her upper. And then check her knees. and her ankles. Good. Now I'm going to check some sensory stuff. So I'm going to touch your arms with a sharp, dull, and soft object, as well as your legs. I'm going to draw something in your hand with my finger, and you're going to tell me what I draw. And I'm also going to place some objects in your hands, and you tell me what they are. Okay? All right. So close your eyes. Tell me what you feel.
Soft, 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 soft. Dull, 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 dull.
And that.
Sharp, 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 sharp.
Okay. And now I'm going to place those objects in your hand, and you tell me what they are.
A paperclip, an eraser, a key, paperclip, an eraser.
Okay. And then I'm going to draw something in your hand and tell me what you feel.
A, B.
Good. All right. Now I'm just going to do your feet and your legs with the sharp, dull, or soft.
Dull, dull, dull. Soft, soft, soft. Sharp, sharp, sharp.
Okay.
Sharp, sharp, sharp. Dull, dull, dull. Soft, soft, soft.
Okay, and then I'm going to touch the bottom of your foot. You tell me when you feel it and where you feel it.
In the middle of my right foot. Heel of my left foot. Big toe of my right foot. Big toe of my left foot.
And you feel it all the way down?
Yes.
All the way down.
Yes.
Okay. I'm going to give you a piece of paper, and it's going to have directions on it, and you do what those directions say. Perfect. And then in 1 minute, I'm going to have you count back from 100 by sevens. I'll start a timer for 1 minute, and you just get as far as you can. Okay? Ready? Go.
100, 93, 86, 79, 72, 65, 58, 51, 44, 39, 37, 30, 23, 16, 9, 2.
Good. Good job.
Thank you.
That's a difficult task to perform.
It is.
I'm going to give you 4 words. You're going to count back from 20 and then repeat those 4 words back to me.
Okay.
Baby, pillow, book, board.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Baby, pillow, book, board.
Good. And then can you tell me where you are right now?
I'm at the doctor's office.
And what year is it?
2020.
And who's the president?
Donald Trump.
Okay, good. And then how did you spend your last birthday?
I celebrated it at a restaurant with my family.
Awesome. You were able to perform the physical exam. I didn't notice any abnormalities. Do you have any questions for me?
I do not.
Okay. I appreciate you taking the time to let me perform this physical exam on you. And before I leave, I'm going to make sure your bed is in the lowest position. I'm going to make sure your bedside table is up next close to you. I'm going to make sure you have your call bell within reach. And I'm going to wash my hands before leaving the room. Thank you.
Thank you.